I'm responsible for the day-to-day operations of Facial Palsy UK. Can everyone hear me? Yeah. And so this is my review of the financial year ending 30th of June 2017. I first wanted to say that we're very fortunate that we've got 6 new trustees this year, and that takes our current total to 9. They bring a wealth of experience to the charity, business experience, fundraising experience, and also personal experience of the condition. So I wanted to welcome them. And we also wanted to thank Alison Sweeting. She's not here today, but she's stepped down as a trustee this year, but she's continuing to fundraise and volunteer for the charity. Clicker helps. Our local support groups run between 2 and 6 times per year. We currently have 10 support groups in England and Scotland. 2 new support groups were set up this year, and that was the Cheshire and Mersey group. That takes place every 2 months, so they're not doing it every quarter like most of the other support groups. And that was set up by physiotherapist Helen Martin, along with Sheila Fairclough, who's the patient representative. Today they're celebrating in Liverpool their first year as a group. Unfortunately, the dates clashed, otherwise they would have been here. In May, consultant plastic surgeon Kaliroy Sosveta, I think you say her name, and facial therapist Marie Matanle started the first group in Chelmsford in Essex, which was also very well received. In addition to regular support groups, we have 2 local support networks in Belfast and Cornwall. With our support networks, people are put in touch with a volunteer running the network, who then establishes how they can best support this person. And meetings are arranged, but on an ad hoc basis as required. The reason they are support networks rather than support groups is because they don't have health professional support. These are individuals with facial palsy that are running the groups on their own, and it's quite difficult to manage a group where you don't know who's going to turn up, because there's about 50 different causes of facial palsy, so that individual running the group might only have experience of Lyme disease, and then if somebody turns up with facial palsy due to cancer and wants to talk about chemo, they haven't necessarily got the resources to support that person, whereas a health professional has a bit more all-round knowledge, but they do a brilliant job. So we also have a support network for mums who experience Bell's palsy in pregnancy, and that's led by volunteer Selma Abbey. Support is offered by email or telephone. It's an opportunity for people to speak to someone who's experienced similar, which can be really helpful and reassuring. So there were 182 attendances at support groups during the year. This was only made possible by the efforts of 19 volunteers who gave up their time, their free time, to organise and run the groups, and we are very grateful for their help. We've struggled to organise local support in Wales due to the lack of specialist health professionals in the country. With over 50 different causes of facial palsy, it's not easy to manage a local group without health professional support, as I mentioned before. So we set about trying to find physiotherapists who had completed training with Facial Therapy Specialists UK. They're an organisation that provides specialist training in the management of facial palsy. Treating facial palsy is a specialist skill which is not routinely taught to physiotherapists or speech and language therapists when they're doing their training. So we found from this inquiry that just 1 therapist in Wales who'd undertaken this training. However, she was only allowed to treat patients from her local health authority area, so that's just 1 local health authority in Wales, and all the rest, as far as we know, don't have any specialist therapists. There's 1 specialist surgeon in South Wales, but he doesn't have a multidisciplinary team, and specialist physiotherapy is not available as part of that service at the moment. We're hoping to work with that team to improve services for people with facial palsy in Wales. I'm not talking too quick, am I? So we continue to offer support via telephone and email as per our previous years. Lorraine, who is our part-time information and support coordinator, stand up Lorraine so everyone can see you. She's brilliant, she's wonderful. She's increased her hours. She works 3 full days per week, and she's a qualified and experienced counsellor, so somebody ringing our office will get proper counselling, somebody with the right experience. She's also got a background in radiotherapy, so she's used to dealing with people with cancer who had radiotherapy, and she's used to dealing with people who've had facial palsy due to cancer. She's been with us a couple of years and I couldn't do without her. She's fantastic. We get a lot of positive feedback about the support she gives. I've noticed a real increase in the last couple of years of the feedback that we get, and that is because of Lorraine. So urgent support inquiries are dealt with by me when Lorraine is not working. So we directly supported 351 people this year by telephone or email. That's a 5% increase on the previous year. These are the key concerns that we have, which are evidenced by the inquiries that we receive. There are inequalities in care for people with facial palsy depending on where they live or their diagnosis. For some people it takes years to access specialist treatment. So what Charles found when he did his survey in 2009 before setting up the charity, that is still happening. There's still a long time before people get treatment. Some people have simply been turned down, and examples of reasons given for non-referral are people are told it is a cosmetic issue and therefore won't be funded. People are told there is a lack of research to prove the money is worth spending on physiotherapy, for example. People are told that because more than one person in the area needs the same treatment, then it can't be classed as a one-off case, and the local hospital needs to submit a business case in order to provide treatment to more than one person with the condition. So if the local hospital doesn't have the resources, which knowing how the NHS is at the moment, most of them don't, to write a business case, we are basically snookered, so we can't get any help for these people. Other key areas for concern are the lack of knowledge of some frontline staff. And just this week we received a call from someone who had been told by their GP to forcefully try and exercise their face to help it recover from Bell's palsy. They only had Bell's palsy for 3 days, and this type of advice could do more harm than good. I've upset Saffron now, so it must be really boring. Many people contact us who were first of all diagnosed with Bell's palsy, but by the time they reach a specialist, find out they actually had Ramsay-Hunt syndrome, a complication of shingles. We've been unable to find any health professionals in the UK who specialise in Ramsay-Hunt syndrome, who have a special interest. You get many health professionals that they have a special interest in cancer to do with Bell's palsy, but not Ramsay-Hunt syndrome. So knowledge about the condition seems to be really poor. So at the moment we're conducting a comprehensive survey to establish the true impact of the condition and the kind of treatment patients are receiving, and results will be published next year. Feedback from support inquiries also tells us that some parents are being rushed into surgery decisions about their children, which we're also trying to address, because there is no rush. Born with facial palsy, I was born with facial palsy, I'm absolutely fine and I'm happy and I didn't have any surgery. So, it's a decision to not rush into, and it's a bit concerning when health professionals do feel it should be rushed. Supporting families. We held 2 family days this financial year, one in July 2016 at Conkers in Derbyshire, and one in February 2017 in London. Surgeons attended both events. Adol Fattar from Alderhay Children's Hospital came to the northern one, and Reuben Cannon, who's just here, came from Queen Victoria Hospital to the London event, and we're very grateful for their support. We received 100% positive feedback about both events. Some of the older children have set up a WhatsApp group where they keep in touch between the events, so that reduces isolation. Parents find it particularly useful to speak to surgeons informally outside the hospital environment. We don't currently have enough interest from families in Scotland, Wales and Northern Ireland to be able to put on these events locally to them. We're investigating holding a weekend conference which would have one day as a family day. This would make it probably more worthwhile travelling long distance, and we would get speakers that would be of interest. We also have a Parents and Carers Facebook group, which at the end of June had 92 members. It has grown again considerably since then to 132 members to date. We allow members from all over the world to join, but it's strictly for parents and carers of children with facial palsy. During this year, we also produced a starting school form, which parents can download and complete before their child starts school. It gives teachers an overview of facial palsy, and parents can explain how the condition affects their child and any help they might need. But more importantly, we talk about the child's, what they can do, what their interests are at the beginning of the form. It's not about the facial palsy, it's the facial palsy as an afterthought, but it gets the message across. So, the children's book. In March 2017, during Facial Palsy Awareness Week, we launched our first children's book. We enlisted the help of children with facial palsy, adults who had facial palsy in childhood, children of adults with facial palsy, teachers, psychologists, and people who had no prior knowledge of facial palsy to create the story. The central character was Teddy, who had lost his smile, and he was befriended by Rosie, who has facial palsy. So I didn't want people feeling sorry for Rosie, so Teddy's like the one who's worried about his smile. Rosie's a very positive, confident character. Don't worry, just come sit down. The book was beautifully illustrated by Andrew Hennessy, whose daughter Christy, she's got Mealy's syndrome, she's here today. Not sure where she is. Oh, she's right at the back there, so obviously Christy got involved as well. We are very grateful to everyone who supported the project. The book has received positive feedback. We do need help to get more copies out there. Every book that goes into a school, for example, has the potential to raise awareness with hundreds of children. Izzy is pictured here. She's here today, donating a copy of the book to her school. She's just gone up to secondary school, so she left the book with her primary school. Website. In December 2016, we completely redesigned our website, as Charles mentioned, so it's more accessible now, easily navigated on every device. This was made possible by a grant from the Big Lottery Fund. There were over 400,000 views of information and support topics on our website, and we've seen a 37% increase, as Charles mentioned, in people signing up to our newsletter since we've had the new website. And 70% of the work to move, refresh and check the content was undertaken in volunteer hours. So also inquiries about local support groups have increased, suggesting people are finding information more easily. Information: the Hospital Saturday Fund granted us £2,000 to develop 8 patient guides about different causes of facial palsy. Our community has given us valuable feedback and the guides are now all drafted. They just need final sign-off by our medical advisory board. It's taken a long time because they're very busy, and I need them to check them before they can be made available to download from our website. And we're also going to seek additional funding to print the guides. Pictured here is this is the first one that's nearly ready to go, Your Child and Facial Palsy. There's all sorts of different ones about facial palsy due to different causes. Freedom of information requests. We issued freedom of information requests to organisations responsible for funding healthcare in the UK. We asked, which of these procedures do you offer freely and which on an individual basis for those patients with facial palsy, and listed possible surgical options including Botox treatment. In England, only 12% of clinical commissioning groups were found to routinely fund surgical treatments for facial palsy. So all those other people have got to go through an individual funding request, which I don't know whether you've seen one. I've had to get one for a different health condition that I'm waiting to fill out. It's 52 pages long. And that just shouts at me, you're not worthy, you don't deserve this treatment, you've got to fight for it. It doesn't make you feel very good about yourself. In Scotland, 2 of the health boards referred to Scotland's Adult Exceptional Aesthetic Referral Protocol, which was developed across NHS Scotland. It puts facial palsy surgery under aesthetic facial surgery and is not routinely provided. However, 21% of the health boards stated they routinely offer surgical treatments locally for facial palsy, with an additional 36% of health boards, including those covering the Scottish Islands, referring to national centres when surgeries are not available locally. The mixed feedback we received clearly shows that even health boards differ in how they view facial palsy. In Wales, every request for help has to go through the Welsh Health Specialised Services Committee, and decisions are based on individual clinical needs, so nobody has routine access to surgical care, which is really disgusting. There isn't a multidisciplinary service for facial palsy patients in Wales, and psychological distress alone will not normally be accepted as a reason to fund surgery. So in Wales, it's a disaster at the moment, as far as I'm concerned. The results of these freedom of information requests aren't promising and point to a complete lack of understanding about the needs of this patient group. However, what we can do is now inform patients who ring us up about where routine procedures are available, as often GPs are unaware of the options. Our general leaflet was redesigned this year to better reflect the support and information we provide. Funds previously received from the Allegheny International Foundation enabled us to leaflet 1,493 GP surgeries and hospitals in England and Wales. We mapped the most deprived areas in the UK and prioritised those because those people won't be able to afford to go private necessarily. And also we prioritised where people are struggling to get that help on the NHS. We leafleted across Scotland in previous years, so we haven't forgotten Scotland. Scotland has already been done. We still have work to do in Northern Ireland. Also, I was invited to speak at a British Association of Plastics, Reconstructive and Aesthetic Surgeons conference for health professionals and trainees involved in facial palsy. Interested in facial palsy. I surveyed over 100 people about how the surgery journey could be improved and presented the results. Feedback from health professionals was really positive, and it promoted discussion, particularly about how children should be involved in surgery decisions. And anecdotal feedback received after the conference suggests there has been some improvement during clinic appointments and parents feel less rushed into surgery decisions. Obviously, we gave feedback from adults with facial palsy as well, but that was one of the key things that came out of that conference, that there was a big discussion about how surgeons should talk to the parents. Also, volunteer speakers helped us raise awareness and funds, and we also achieved 17 media mentions this year with the help of our media volunteers. For Facial Palsy Awareness Week 2017, which was in March, we pushed the message that happiness isn't always shown on your face to raise awareness of facial palsy. Activities on social media included sharing personal stories about facial palsy and thanking those that support us through our treatment journeys, because they can make a huge difference to support the family and friends. We also ran a Twitter competition in partnership with 1 Minute Briefs. Designers who follow 1 Minute Briefs on Twitter were given the brief "Happiness isn't always shown on your face" and given 1 minute to come up with a design idea. There were more than 30 entries to choose from, and here you can see the winning design. Turn that frown upside down. For people with facial palsy, it's not that easy. We all know about these cheer up love, all these daft things that people say to us. So it was quite nice to get that sort of feedback. This competition raised a lot of awareness. We achieved over 67,000 Twitter impressions during March 2017, an increase of 60% compared to the previous year. We also encouraged people to write to their MP, to their local MP, highlighting the need for better healthcare. We provided a template they could use. People shared their stories in local newspapers, and we also launched the children's book. Fundraisers raised a total of £6,360 during Facial Palsy Awareness Week, with bake sales, sponsored face painting, walking the West Highland Way and more. We're extremely grateful to everyone who fundraises for us and to all those who raise awareness in any way. Our research activities this year included a priority setting exercise using a Delphi study to ascertain the top 10 priorities for research. I won't go into too much detail here because Claire Hamlet will be talking about that in more detail after lunch. We're also partnering with Nottingham, Trent and Coventry Universities, MTech and Queen Victoria Hospital on the FRAME project. FRAME stands for Facial Remote Activity Monitoring Eyewear. The purpose of the project is to develop a device in the form of a pair of glasses which will allow people with facial palsy to carry out their exercises more easily. It also has the potential to be used as a measuring tool which could standardise the way we collect data and make larger scale randomised controlled trials easier to carry out. Larger trials equals better evidence, equals more chance of improved NHS care for people with facial palsy. What makes it happen? So They helped in so many different ways during the year, running support groups, helping with research projects, helping at events like today. We have volunteer speakers who go out to Rotary clubs and talk about their personal experience with facial palsy, and we have media volunteers. Our medical advisory board check our website medical content in their spare time. They help at family days, they fundraise for the charity, and some of our volunteers help with social media, graphic design and distributing literature to GP surgeries. This year, many people help give feedback about the patient guides we've been developing. Volunteers also motivate family and friends to get involved, as Vanessa mentioned, and help with our cause. We simply couldn't do what we do and achieve what we do without their help, so I want to thank each and every one of you for all of your efforts. So individual fundraisers have once again contributed significantly to our income, for which we are extremely grateful. They raised £45,000 over the year, up by 24% from the previous year. 14% of this was raised during Facial Palsy Awareness Week. Just under 16,000 of this total has been set aside and restricted to funding 2 specific projects. These are the Children's Book Project. 7,000 was raised by Leamington and County Golf Club. And the other funding is for GP awareness. Debbie and Steve Biles and friends and family raised £8,851 with Charity Fest, a summer festival they put on in their local town in July 2016. I have nightmares organising events like this. I don't know what sort of nightmares they must have organising Charity Fest, because it's a huge event and very well attended. We're very grateful for all the hard work that's been put in by all of our fundraisers. We are trying to increase the number of small regular donations we receive, as this will help us better plan for the future. Monthly direct debit and standing order income is up by 40%, and we now have 19 regular donors. Payroll giving has also increased. We're very grateful for this support. Income via Give As You Live is down by 24% compared to last year. This is a really easy way to help the charity to raise money, because it doesn't actually cost you any money. It's if basically you sign up to Give As You Live and you then choose your charity, and then every time you buy something online, a few pennies go to the charity, and it soon mounts up. Especially if you're doing your shopping, your food shopping online, please look at Give As You Live. Amazon Smile has just come to the UK, but they're only selecting a few charities at the moment, but I'm on the list waiting to see when we can get into their online giving scheme. I'm also signing up for Facebook fundraising and donations as well. We've also signed up to Savu, which is a voucher site which gives us a commission if people use it. There's lots of information on our website, and I put some leaflets in the restaurant as well. There's a new initiative called Charitable Bookings, so if you like eating out, you can book restaurants via an app, and every diner there's a £1 donation made to the charity for every diner. Doesn't cost you anything. We would also like to thank the people who put our name forward for corporate donations and all those who made personal donations. People have been very generous, and we really appreciate your support, and we are grateful to you all. Not too much longer, I promise. The Great North Run, 4 runners took part in September 2016, which is in our last financial year, and here you can see Aaron and Guy pictured on the left. 2 runners also took part in the London Marathon in April this year, raising funds for the charity. Here, Robert Wildman is pictured. We'll tell you more about what else he's been up to later. Be warned, Robert. We are always asked if we can get London Marathon places, but unfortunately we can only get 1 per year of that. The places aren't offered to the newer charities as much as the older ones. I want to say thank you to all those who sign up for any running event, braving all weathers to train, and basically having the determination and stamina to carry it through, because I couldn't do it, so I'm very grateful. This year there have also been pub fundraisers, nuclear obstacle races, Tough Mudder challenges, football matches, sponsored head shaves in Spain, sponsored walks, coffee mornings, Santa fun runs and more. I wish I could mention every event and every person who's helped, but there's simply not enough time because there's so many people. This is just a selection of pictures from our fundraisers, and thank you to everyone for all your support. Financial review. Our annual report and accounts will be available to download on our website in the next couple of weeks. I've put some unsigned copies out by the notice board area if you want to have a look through. The chart gives a breakdown of where our income comes from. Most trusts and grants chart help, wouldn't it? Most trusts and grants income is restricted, meaning we can only spend it on specific projects and not on our running costs. Our total income increased by 17.5% this year to 123,000. This includes project-specific income of 64,000. For example, 26,300 was a grant received from the VTCT Foundation, and that's to develop a new health professionals website. And part of the reason why we got that funding was because Debbie and Steve Biles and their team had already raised some money and we were able to match it. So that was a stimulus for us getting that additional funding. Our total expenditure increased by 51.9% to 98,000. This includes all the project-specific funds spent on research, children's book, family days and leafleting GP surgeries and hospitals, so that money had been set aside to spend on those things. Lorraine's salary and funds to run our support groups were previously supported by a grant received from the Rain Foundation. These funds are due to run out early 2018, and we were recently unsuccessful in getting further funding for our support services. So we're a bit concerned about that at the moment. But we have set up a Christmas appeal to help with this. Unrestricted expenditure is not tied to a specific project, so on our core costs, decreased by 9.7% to 48,000, so we continue to be as frugal as we can. I'm actually Chartered Institute of Purchasing and Supply qualified, so my background is saving money, so that's why we're hopefully quite good at it. How do we spend a £1 donation? 87% of our income is spent on delivering and improving care for people with facial palsy. 10% is spent on running costs and governance. 3% is spent on fundraising. Fundraising applications are normally completed by me with help from the trustees, who are obviously unpaid, and a proportion of my salary has been apportioned as fundraising costs. And obviously we have the costs of supporting our fundraisers as well in that. Reserves, we don't get regular government funding. We've had a little bit towards the frame project this year, but certainly it's about 3%. We're very reliant on the generosity of donors, the enthusiasm of our fundraisers, and how the wider economy is performing. Free reserves are basically our savings to cover us in the event of a problem. So, for example, if our income is significantly reduced, holding reserves also demonstrates to potential funders that we are a safe investment and our work is sustainable, so they're unlikely to fund us if we don't have something to fall back on. Our future target for free reserves is 31,000. This is 6 months' worth of core expenditure, including what we spend on support services. So obviously we have to be careful, because if I was suddenly run over by a car, you need the funds to pay me to be a little while I'm off sick, and also to pay somebody to replace me. That's why we've got to make sure we keep enough in reserves. So we wish to thank every single person and organisation who has supported Facial Palsy UK in any way throughout the year. Every gift is used carefully to improve the lives of people affected by facial palsy. We do watch every penny, and we're very careful with your money. Future plans. All of our regular activities will continue. I'm just going to mention anything new today. We're developing a new health professionals website to improve knowledge, encourage collaboration and research. GPs and other health professionals will be able to access a wealth of expertise, thus improving patient care. Developing this new website is going to be our largest project, 2017 to 18. We plan to publish a report about the results of our Freedom of Information request to highlight the inequalities in care across the UK. I'm also going to issue Freedom of Information requests about the availability of physiotherapy next month, and find out what's happening with physio, as well as what we already know about surgery. Research trials for the Frame project will begin in 2018, although I'm not sure when yet, and if you've got any questions about that today, ask Charles, because he'll know. He knows what's happening. Facial Palsy Awareness Week. It's the first week of March every year. not much longer, I know we want dinner. This year's theme is called In Your Face. We need your help sharing lots of facts about facial palsy to raise as much awareness as possible. We also need to push the message that this is not a cosmetic condition, it is one affecting function of the face. So basically it's about what is happening in your face and not what everyone else sees. So when you get these people that say, oh, well, it doesn't look too bad to me, well, I'm sorry, you're not living with it, you don't know how it feels. As well as reporting on the Freedom of Information requests, I want to publish the results of the Ramsay-Hunt syndrome survey. We're working with a talented photographer who's here today, Helena, I'm not sure where she is, but there she is. And she's photographed her entire recovery from Ramsay-Hunt syndrome, and it's just fabulous, the photos, and we're hoping to help organise an exhibition of these photos. We've also been sent some ideas for infographics and posters to raise awareness. We'll be using the hashtags InYourFace and hashtag NotCosmetic on social media during Facial Palsy Awareness Week. One of our trustees, Jan Jutson, who's over there, came up with the idea of painting numbers on our faces to raise awareness. Lorraine and I have done a quick example with some lipstick. We're not very artistic. I'm sure people like Selma Abbey will be much better at it. Another of our volunteers, Chelsea, came up with the idea of holding up signs to explain the numbers. This is a quick and easy way to raise awareness on social media. Or just going about your day with numbers on your face should certainly prompt some questions. Well, I'd hope so anyway. Sample quick facts. The nice thing about this campaign is that you can personalise it to suit your own circumstances, or you can use basic facts about facial palsy. You could also do a different fact each day during Facial Palsy Awareness Week, which is what I think I'll do. So it could be the 72 hours to take steroids for Bell's palsy, 0 facial palsy specialists in Northern Ireland, 20 years been waiting for treatment, 72 hours to take antivirals for Ramsay-Hunt syndrome. I think Mandy suggested so many years for how long it's taken to actually meet somebody else with the condition, highlighting the isolation that people can feel. Fundraising ideas, they can be worked around the numbers. So you could have 72 cupcakes bake sale. You don't want me to do that because they'll taste horrible. If you're feeling very energetic, a 72-mile bike ride. I won't be doing that either. The only 72-mile bike road I've found is the Tour de Tahoe, though, around Lake Tahoe in the USA, which I think is a bit far to travel. Other options might be 72 hours without sugar, or 72 hours sponsored silence, or you could ask someone to do a 100 press-ups challenge. I think they might struggle in a day, though, but they could work up to it over a month. This could be the same number of Botox injections you have to put in your face each year to manage synkinesis. Because if you add them up, it's a lot of injections and they're not very nice. Or for 50 causes of facial palsy, you could see how many Maltesers you can move from a plate to a bowl in 50 seconds, but using chopsticks. These are just some of the ideas we've thought of, but I'm sure you'll have lots more. Great North Run, we have 5 places for the Great North Run, which will take place on the 9th of September 2018. It's a hugely popular half marathon, which attracts a lot of well-known faces. Mo Farah won the race for the 4th time this year. We had a slight problem though. Being a small charity, we can't afford a spot in the charity village, so we greet our runners in the family and friends zone next door, and we wait under the F for facial palsy flag. The presenters kept trying to explain where to meet people, and said if you are called Mo Farah, you need to wait for your friends and family under the F flag. Well, the only person sat under the F flag was my husband, Brian, and people kept asking him where he was hiding Mo, and they were coming for their signatures, and they were a bit disappointed when he said, I'm sorry, he's not here really. So if you know anyone who might be interested, please could you ask them to get in touch. The photo above is taken of Kathy and Jeanette from Northern Ireland, who took part in this year's event. The dinosaur isn't ours. I'm nearly done, I missed. We've been looking at other avenues for generating income. In previous years, we've held a grand prize draw, but this is quite labour intensive as it takes hours trying to find the raffle prizes, and then you have the cost of distributing the tickets, collecting money and posting prizes. This year we decided not to hold the grand prize draw as we felt people were a bit fatigued by it all. We spoke to a Burns charity earlier this year who run a very successful 100 club. One of our volunteers has been researching how to organise this and to see if it could work for us, but we need to gauge interest before going any further with it. If we could get 100 people to join and they each pay £24 for the year, based on 100 people, £1,200 would be paid out in prizes, and 1,200 will come to the charity. So I put a form out for people to register their details if they think they might be interested. There's no pressure, you can always change your mind. But I'll add something to the website about it as well. Lorraine knows where the form is. It's out in the foyer area if anyone's looking for it. And that's it. So has anyone got any questions? No? Just when's dinner? Where's the food? Yes.